So, the parts I have on the board that I wanted you to know for this, the first thing on the top of the list was heart. Okay, to get to the heart, you're going to have to make an incision through the skin here, the chest, and then you're going to have to cut through, most likely using your scissors to cut through the rib cage to open and expose the thoracic cavity. Then right here in the center is the heart. Now, I will say here, and I am going to take back what I said, I'm going to make one cut here. Because the heart sits in this bag. Remember I said everything or nearly everything in the body is surrounded by this like saran wrap like material called peritoneum. Around the heart, the peritoneum's name is pericardium because it's named after the heart itself, surrounding the heart. So this right here is the heart, okay? Right in the center of the chest. Now their chest is slightly different than ours in the fact that their chest is going to be, ours is kind of flatter and wider because our collarbones, the clavicle pushes our shoulders back, whereas four-legged animals, their shoulders are all forward and their chest is like sort of deep and narrow like that from side to side. Okay, so here is the heart, and on the heart you can name a bunch of different features if you want to. At the top of the heart you have right atrium, that one there. You have left atrium that'll be closer to the top here. Oh, boy, this pericardium's tough.
Mr. Alec, do you have any more medium blood?
I don't. Yeah, but I've got it kind of pulled back here. And so you can name some other features here. It may benefit to irrigate some of this specimen because there's a lot of dye and junk in there. But so there's the heart. Surrounding the heart on either side are the lungs. Here we've got left lung, right lung. You can name those. You can name the lobes of the lungs as well. Now right below that, and what separates the thoracic or chest cavity from the abdominal cavity is this dome-shaped muscle right here that I'm lifting up. What's this muscle called? Diaphragm. Everybody take in a deep breath. Smell that delicious air, okay? That pulls down. Now exhale. As you exhale, that diaphragm comes back up again to decrease the volume of the lungs. But that is the barrier. You can see it kind of forms this perfect barrier from the thoracic to the abdominal cavity. And if you go right below that, you'll see this huge organ here. This one here is the what? I'm glad we're having this conversation. This is the liver. Okay. Now, in most of the specimens, you'll see the liver is kind of a darker color, but you can't count on color. Rely more on location, attachment, and texture in this rather than color. Okay. For the most part, the liver is going to be a smooth consistency, relatively rigid as well, about as rigid as the heart, much more rigid than the lungs. And if we flip this up and look at the underside of it here, look at the underside of it here, you should find a little bag-like structure there, and that is the gallbladder. Okay, on this guy it's right there. That's the gallbladder right there. Okay, all right.
That tiny thing you pointed to?
Yeah, most of the other ones it's a little bit bigger, but in every one I've seen it's attached to the underside of the liver itself. So if you peel that back, you'll find it, but it's this little bag there. Okay, all right. Moving over this way, you'll find the stomach. It's deflated here because there's nothing in it because I haven't eaten anything. This is the stomach. It can expand pretty wide and hold, a pretty good amount of food and stuff. So that's the stomach there. And since we're in the neighborhood here, there is this, and it's going to have more of a red color in most of your specimens. This right here is the spleen. It's on your left side. In us, it's shaped a little more like our kidneys than this long, skinny shape. But in a fetal pig, it's shaped like that. Okay. Now on the underside of the stomach, we got kind of a mess here. Okay. I'm going to trim away a little bit of this mess, this peritoneum, because what I'm looking for is going to be probably housed herein. Okay. What I'm looking for is the pancreas, and the pancreas looks a lot like cottage cheese. As far as texture, I wouldn't count on the color. Like I said, a lot of these colors are not very vibrant, and because there's no blood in them, they push through the system. They push through their system. They're going to push the latex dye, which accounts for those red and blue colors. But if I trim this back, you can start seeing it in here. It's on the underside of the stomach. And I'm going to try to pull some of this off so you can see what I'm talking about. This is the pancreas right here. And do you see what I'm saying about the sort of the cottage cheese texture? It's got like these little tiny sections all together because it's a gland. Now it's an endocrine and an exocrine gland because it produces stuff that goes into the bloodstream, insulin, and it also produces stuff that goes into the digestive tract, which is pancreatic juice. We make about between 1 liter and 1.5 liters of pancreatic juice every day that gets pushed into the duodenum, or first section of the small intestine, to help both to neutralize the acid, and also it has a lot of digestive enzymes in it. Next is the bladder. This gets a little weird, so you got to follow me on this, okay? This is the umbilical cord. The umbilical cord is 3 large blood vessels that come in here. One goes straight north here, or superior. Actually, no. On this, it would be anterior. But for us, it would be superior. And then the other 2 head... Whoa, that's weird. You see that bubble? That's weird, though. All right. The other 2 blood vessels head down this way and plug into the iliac. But in between the 2, this is so weird, folks. Right in between the 2 here, that's the urinary bladder. Oh, you can't see what I'm pointing to. My bad. Okay. So here's those blood vessels. Here and here. And in between the 2, long and skinny, is the urinary bladder. Okay. This, once the, after development and stuff, once the umbilical cord heals into the umbilicus or umbilicus, these blood vessels will disappear, and this bladder will settle back down into the lower abdomen here. Next on our list was kidneys. Kidneys, you'll just have to move the intestines to the side, and you'll see these lumps in the back here. And again, they're covered with this the saran wrap material, layers and layers and layers of it. But they're back there underneath that. You'll find one on each side there. Here's the other one. Okay, and ours are the same way too. They're embedded in the back wall of our abdomen, covered with a number of layers of connective tissue. Next on our list was small intestine. That's all of this kind of brain-looking structure here, small intestine. And then the large intestine is over here kind of by itself, all spooled and coiled together like that. Large intestine is the same thing as the colon, so this is also known as the colon. Next on our list is rectum. A lot of people get rectum confused with anus. It's not the same thing. Anus are 2 sphincters, or round muscles, that open to allow things to pass and close to keep things from passing through. We have 2 anal sphincters, one internal that we don't control and one external that we do control. But above that, or superior to that in us, is this last section of large intestine right here, and that last section is known as the rectum. That's what fills with fecal material to be exported, if you will. So when this fills up, that's when it tells our brain, hey, we got to drop this off someplace. Okay. All right. So spleen we got. That was the long one on the side here. Diaphragm we've already named, so I think we've got them. Anything else you want me to go over again?
Can we go over the bladder?
Sure, yeah. Bladder is like I said, it's kind of weird. You have to find where the umbilical cord attaches right there.
Okay.
Follow those tubes down here, and it's in between these two blood vessels. The bladder is this long, skinny structure right here. Yeah. Okay, other questions? Folks, it's weird. You're like, that doesn't look like a bladder. Eventually it will. A lot of changes happen. Folks, think about it. In the womb, you go from one fertilized egg to essentially you. A lot of cool things happen. One of those things is like your hand starts out as a mitt. And then during that time, almost like an invisible knife, because of cell division, comes and divides all your fingers out into separate fingers. Your eyelid starts out as one piece of skin and then gets divided in half right down the middle. It's crazy, like lots and lots of things. This is how the urogenital development all kind of happens at once, like the genitals of the body and the urinary system start developing at the same time, and a lot of from the same structures. And so that's one of the reasons these are all tied in together. All right. Other questions? All right.